Okay, so we're 1 week after a surgery with my friend here. John's in the chair here. So I've known John and his family for a long time. Nice guy, hardworking guy. And he had some dentistry done in the Middle East many years ago. And unfortunately, that dentistry failed him. And what failed was the root canal therapies that he's had in these areas there. So we had to fix things up. And what did we do? We did what's called an apicoectomy, which I've done. I have one on my YouTube channel, an actual surgery, but we did an apicoectomy over this tooth and this tooth. So that means the tip of what basically happened was the tip of the root was infected. I raised up the gum, exposed the tip, exposed the tip of the root, cut off the tip of the root, cleaned out the infection, and put the tissue back. What made this one a little bit more challenging and longer was because it was 2 teeth in a row, but not actually 2 teeth in a row. It was two teeth that were apart by 1 tooth. Remember, look, I did the apicoectomy on this one. This root was healthy, and this one also needed it. So my incision went like this. How do you get to this? Is that if you see in the back here, there's a little horizontal incision, actually an oblique, oblique incision right here. So I took my cut from here down across into the sulcular epithelium, next to the tooth and the gum, right down into the bone, across, and then a vertical here. I lifted it in one piece, and we did both surgeries. I think it took about 40-45 minutes, and there was a ton of infected, dead, and decaying bone and smelly stuff up in his jaw. And he said he only took 1 pain medication. He iced it, of course, and he was very careful. And look at this result. Open for me, please. Where did I make the cut? In the gum here. Do you see a cut? I don't. And even posteriorly, we can barely see the healing cut. That was fully cut right down to the bone. This needs a little bit more granulation in here. This has to heal up a little bit more. That's okay. Another 2 weeks from now, you won't even know there was a cut in there.